So this guitar thing that you are talking about comes under functional neurosurgery, where there is a disturbance in the electrical activity of the brain. And the brain is a very complex organ. It's one of the most complex organs in the body. And when there is this electrical disturbance, then patients get either they get spasticity of their muscles, or they get twitching of the muscles. There is a abnormal movement of the muscles.
See, what's peculiar about this dystonia is they have no paralysis. The hands are all fine. Only, and even if he pretends to play the guitar, it's fine. The moment the guitar is in the hand, he tries to play, the fingers start cramping. There is some strange force stopping him. So he showed me these 3 fingers of his left hand, but not just listening to him.
These two have become so stiff, I cannot bring it on the fretboard. I can't.
God.
It has become so stiff. I cannot move at all.
I can see that.
See, can you see?
I can see that.
I'm trying, but I cannot.
So there are 2 types of surgeries for treating these people when the medicines or medical line of treatment fails or has a limitation. The first, which actually started with the lesioning surgeries, and then it morphed into DBS.
So deep brain stimulation, in short DBS, is where an electrode is put into the brain, and that electrode stays into the brain, which is connected to a IPG or a impulse generator. And then when the impulse is generated, this stimulates that part of the nucleus which we want to put, and gives an effect. What is lesioning is we go to that part of the nucleus and do a radio frequency ablation on it, or we burn that area or the nucleus, giving a similar kind of a result. The difference is in deep brain stimulation we can do both sides together. In lesioning we can do only one side. In deep brain stimulation we have got an implant always throughout our life. In lesioning we have no implant.
Deep within the brain lies a group of structures known collectively as the basal ganglia. The basal ganglia act as the switchboard for the brain circuits that control movement. One important structure within the basal ganglia, the substantia nigra, produces a chemical known as dopamine. Dopamine is transported to other areas within the basal ganglia, and this enables the coordination of smooth and balanced muscle movement. Parkinson's disease causes the cells in the substantia nigra to die, which results in less dopamine within the basal ganglia. This results in the motor control symptoms associated with the disease. Often, Parkinson's disease is treated with medications. Most medications increase the level of dopamine in the brain or mimic the effect of dopamine. When medication increases the level of dopamine, this indirectly enables the basal ganglia to function at higher levels, thus reducing symptoms in many patients. While medications can be used to improve motor function, it is possible that they may lose their ability to do so over time. When this occurs, the symptoms of Parkinson's disease may again become more pronounced. DBS therapy uses a medical device, much like a cardiac pacemaker, and thin, soft, flexible wires, called leads, completely inside the body. While the device is implanted beneath the skin in the chest, the leads are implanted within the brain. Electrical stimulation is then sent directly to targeted areas within the brain. Stimulation of these areas enables the brain circuits that control movement to function better. This results in a reduction of some symptoms in many patients.
So truthfully, a lot of people think that if I can't afford DBS, I need to undergo lesioning. And according to me, that's not true. Okay, so it's not a poor man's treatment, honestly speaking. So I want to actually clear some of these myths. Number one is both surgeries are equally safe or equally risky. At the end of the day, we're both going inside the brain. One is permanently inside, one is actually I'm coming out after burning, so it's not an issue. So they actually complement each other, rather than compete with each other. So once people understand that neither is it a poorer cousin, nor is it done out of desperation, they have their own indications, and if you can understand that and use it judiciously, like I said, you don't need AK-47 to kill a fly. you can still do this. And those who cannot afford, for sure, instead of allowing them to suffer, you have definitely a cost-effective treatment. It's 1/5 the cost, and they can definitely make a difference. And this is called stereotactic neurosurgery. So we actually fix a special frame to the head, 2 screws in the front, 2 screws at the back. We actually screw the screw into the skull under local anesthesia. Then we do a special MRI, and that MRI gets into a special software that I have. I sit and plan the target. Usually all these targets are more than 9-10 centimeters inside the brain. And we reach the target with a 40-millimeter hole in the skull, through which we can't see anything. So honestly, it's a blind procedure technically, but technically far superior because the technology supports me in what is happening apart from my understanding of the anatomy. And then, so that's what we started, and he had the guitar, and as I'm burning, which I saw happening in Japan, the fingers released. One by one, I had to burn 7 times. As I was burning, he says, "Doc, this is better, and he started playing.
Abhishek's surgery was the first surgery actually Dr. Sharan did after he came back from Japan. A very stressed event, I should say, for us, because it was the first time he was doing, and there was a lot of things that he had to put into place. And about getting viral, I had heard about it, but really did not know what it meant. But then I think Dr. Sharan has mentioned he allowed his wife, Abhishek's wife, to come into the last part of the surgical part. And in the OT, she took a video, and then she put it up on the Facebook, and that went viral. And really, when we traveled to Antarctica, when we saw Santiago carried in Santiago Times his picture and news, that is when we actually understood what is viral.
I just want to mention one thing in the end, that if you have a dream, if you want to achieve something, then please don't quit. Keep on trying. Things will work out one day. There may be difficulties, there may be failures, but definitely one day everything will work out and everything will start making sense. If I can overcome my physical disability, then anything is possible.